Hello and welcome to this tutorial on cerebrospinal fluid. This is part 1 of the lecture series of the central nervous system. We would continue to discuss the cerebrospinal fluid. How does it gets produced? How does the circulation would occur? How does the absorption would occur? What are the functions of the CSF fluid? And most importantly, what is the cleaning? To understand the CSF fluid, we need to understand that there are two lateral ventricles that are present, and a third ventricle and a fourth ventricle. CSF circulates through these ventricles. Coming on to the production, it is normally produced by the choroid plexuses that are present in the CSF fluid. It is already marked in these slides, like these are the choroid plexuses that is present in the lateral ventricle. This is the choroid plexus that is present in the third ventricle, and this is the choroid plexus that is present in the fourth ventricle. These choroid plexuses, through the transcellular shift, they produce the CSF fluid. They normally produce around 500 ml of say CSF fluid per day at a rate of 25 ml per hour or at a rate of 0.3 to 0.35 ml per hour. But it will be rapidly reabsorbed. Because of it, at any given point of time, that would be 125 to 150 ml. 125 to 150 ml would only be present in the around the brain. So this gets circulated, as I said, from the lateral ventricle through the interventricular foramen to the third ventricle, from the aqueductus sylvius to the fourth ventricle, from the fourth ventricle to the foramen of mesendae, subarachnoid space, and in the subarachnoid space, it gets absorbed by the arachnoid villi that is present in the superior sagittal sinuses. So the production is by the choroid plexuses, and by the absorption is by the arachnoid villi. Remember that from the fourth ventricle it is connected to the subarachnoid space through this foramen of Lashka, foramen of mesendae. This I am stressing because this can get blocked and can lead to the syndromes like Arnold-Chiari malformations and Dandy-Walker malformations, which would cause hydrocephalus in children. Functions of the cerebrospinal fluid, it helps in the buoyancy. Normally, the brain would weigh 1500 grams, but when it is suspended in the CSF, it would weigh 25 to 15 grams. This buoyancy, by reducing its density, impedes its own weight, and helps in not cutting off the blood supply or killing the neurons in the lower sections of the brain. It also helps in the protection of the brain from mechanical trauma by acting as a shock absorber. It also clears the waste material and provides the nutrients to the brain, and it prevents the brain ischemia. Whenever there is raised intracranial tension, CSF formation would get reduced. Because of it, ICT, intracranial tension, would get reduced, thereby facilitating the decompression of the blood vessels that are present in the brain, so that it facilitates the blood flow to the brain. Coming on to the clinic, most of us, we confirm the diagnosis of meningitis by doing the lumbar puncture. We differentiate between the bacterial meningitis, viral meningitis, tubercular meningitis, fungal meningitis, etc. by by the appearance, pressure, white blood cells, proteins, glucose, chlorides. Analyzing these parameters, we differentiate between these types of meningitis. So most of the times, coming on to the appearance, it would be turbid in bacterial meningitis, and in other meningitis it would be mainly clear. Coming on to the pressure, normal pressure would be 6 to 15 millimeters of mercury, or 90 to 180 millimeters of hydrostatic pressure. When it is measured in terms of water, it would be 90 to 180. When it is measured in terms of mercury, it would be 6 to 15 millimeters of mercury. In all the meningitis, it would be increased. The pressure would be increased. Coming on to the WBCs, it would be very much increased in bacterial meningitis and marginally increased in other types of meningitis. And it would be most of the times it would be polymorphs in bacterial meningitis. In other meningitis, it would be either lymphocytes or the mixed cells. Normal proteins would be 15 to 45 milligrams per deciliter, but these are very much increased whenever there is a meningitis within the brain. And by analyzing the proteins, we can also diagnose certain immunological disorders like multiple sclerosis, systemic lupus erythematosus, etc. Normal glucose within the cerebrospinal fluid would be 2/3 of the plasma glucose, that is 50 to 80 milligrams per deciliter. It would be reduced because these leukocytes and the microorganisms that are present in the brain would utilize them. Based on these parameters, we can differentiate the meningitis, and we can come to a diagnosis whether it's a bacterial, viral, tubercular, or fungal meningitis. to give medications like chemotherapy, thecal chemotherapy and all. So let's test ourselves. CSF pressure is mainly regulated by rate of formation, rate of CSF absorption, cerebrospinal fluid, or venous pressure. So it would be mainly regulated by the rate of absorption. CSF plasma glucose ratio would be 0.2 to 0.4, 0.6 to 0.8, 1.2 to 1.6, 1.6 to 2.2. So it would be normally 2/3 of the plasma glucose. So the answer would be 0.6 to 0.8. CSF does not pass through ventricles, venous sinuses, epidural spaces, subarachnoid spaces. It passes through the ventricles and the venous sinuses and subarachnoid spaces, but it doesn't pass through the epidural space. CSF production per minute would be 0.3 to 0.35 ml per minute, 0.5 ml per minute, 2 ml per minute, 1 ml per minute. These are the basic facts that we should remember. 0.3 to 0.35 ml per minute. Normal CSF pressure would be 1 to 2 mm of mercury, 6 to 12 mm of mercury, 15 to 30 mm of mercury, 730 mm of mercury. As I said previously, it is 6 to 12 mm of mercury. Thank you for watching this lecture series. I look forward to see you in the coming other lecture series of CNS and other lecture series which are coming to go ahead, which are going to come. Thank you for watching. Thank you very much.